Time for Good Evening America with Otri Bona. Now, live from Charlotte, North Carolina, here's Otri Bona.
In America and the world with Otri Bona. This is your host, Otri Bona, and thank you for tuning in and for inviting us into your homes and offices tonight. As you know, my show is featured every Tuesday night at 8 p.m. Eastern Time, and it lasts through 9 p.m. Eastern Time. Listeners can simply go to www.haramberadio.com and click on Listen Live and be there with us. And I hope that is what you are doing right now, and you can give the number and the link also to your friends to call in. Our goal is to inform, entertain you, and also to educate you. And I hope by the end of our show tonight, we would have achieved this very goal. As we know, tonight marks the eve of another year. We are so grateful to God that another year has come to meet us, and we know we are getting ready to usher ourselves into a very prosperous and a healthy 2014. I remember last year at this time, my show, we featured what people expect to do at the new year. We talk about New Year resolutions, and we talk about some of the tips. I had Dr. Obin with me last year and Mr. Gatetego, and we talk about health issues, basically. And that is exactly what we are going to do tonight. And tonight is going to take another dimension. I have very, very astute and wonderful men who are going to help me to talk about it. These are experts, and they are very passionate about this very topic, which we call it a better health in 2014. So we are wishing you in advance a better health in 2014, and we are here to help you with some of the things that you need to do to make your health a better one. Most of them you know, some of them may be new. As I know, Mr. Abiomens has some very, very unique and some peculiar suggestions to make, which may intrigue you, which goes beyond the normal things we talk about when we are talking about health. And he is very much into diet and some of the natural foods you can eat to get well and to have a longer life. So without much ado, I will just invite my expert, my guest tonight. We are privileged to have Mr. Abion Mens with us tonight, and also my old friend, Dr. Kennedy. I want to see, I think Mr. Abion Mens is online. Hello, Mr. Mens.
Yes, Mr. Bena, I'm here.
Wonderful, wonderful. We are so privileged and excited to have you tonight. And I know you are very passionate about this, and I'm sure we cannot get a better gift for 2014 than to have you on the show to educate us, to see how best we can take care of our exercise and also take care of our diets. Thank you so much for coming tonight. May I know if Dr. Kennedy is online now? Maybe not yet. Okay. My guest is Mr. Abion Mens. As you know, I just welcome him to the show. Mr. Abion Mens is originally from Ghana, West Africa. He's now residing in Missouri. He grew up hearing stories that captivated his imagination. He is a storyteller, motivational speaker, and seminary-trained minister of the gospel. Mr. Mens has spoken throughout the United States and various parts of the world. He brings an African oral tradition to life. Our lives, our stories, he says. Mr. Mens is the oldest of 8 brothers and sisters. And I know she has 2 beautiful daughters with their families, and he has also 4 grandchildren. Mr. Mens is currently serving as an instructor at the University of Central Missouri. He teaches multiple courses in religious studies and African studies. And on the line, too, he has a non-profit organization which does well to educate people and how to make them have a better life of issues. So, Mr. Mens, we are very privileged to have you. Welcome to our show.
Thank you. It's an honor and just a privilege for me to speak to you here this evening, and I hope we'll be able to entertain and, as you said, be very, very informative, and we will all be good and better in the year 2014. Thank you.
You're welcome. And I believe Dr. Kennedy is online now. Dr. Kennedy, are you online?
Yes, I am.
Wonderful, wonderful. We are privileged to have you. And as my audience, most of you know Dr. Kennedy. Dr. Kennedy has been with us several times. We thank him. He takes time off his busy schedules and tries to help to educate and, as you know, entertain and also to inform as much as you do. Dr. Kennedy is a family practitioner, a medical doctor. He's also an author of books. 2 main of the books are The Drug Invasion of Africa and then also the Chasing the Elephants. He's a politician and he's a social activist. He's an educator and he's also a sports enthusiast. As you know, he's very astute in these subjects, especially sports. As you know, he was here a couple of weeks ago to help us. Above all, he's a family man married to Evelyn Kennedy with 2 kids, Kofi and Kwame. And Dr. Kennedy, we are very, very privileged to have you tonight. Welcome to our show.
Thank you, and good evening and Happy New Year to your audience.
Wonderful. Dr. Kennedy, I'll go ahead and I'll be quoting your article because I just found out that you wrote an article. I don't know whether it has been published yet or it's going to be published on the 1st of January. It was about a better health, wishing people a better health for 2014. And very important suggestions, which we'll be taking some of them. What I intend to do is maybe use the first half to talk about those ones. And also, we talk about the food, exercise, and other things which Mr. Mens is very passionate about. And also, I was looking at Dr. Mens, your website, and I saw Dr. Essel's 7 deadly diseases, and we look at those things. I think some of them are embedded in Dr. Kennedy's article. So talk about them, and then we go ahead and maybe treat them individually as much as time will permit us. Yeah, Dr. Kennedy, you said how to get the best out of the health system because you were alluding to Africa, how, we know that our plight, most of our health facilities are not as to standard as it is here in America, and people die here and there due to no fault of their common mistakes, like we're even talking about an incident of oxygen where you were torn between plugging it off to give it to somebody else who came new or just to give it to the old person, and that dilemma, which was part of the article. I hope you will tell us a little bit about that maybe as we go. But Fred, you said that to have regular contact with health professionals and perform tests that are recommended for our age is very essential for keeping our health well in 2014. Can you expatiate on that?
Sure, I can. I actually was stunned during my 2 years of working in the teaching hospital in Africa. And that surprisingly, one would expect that since we are poor and we cannot afford the treatment of many diseases, we would emphasize prevention. But that is not the case. I think that the old saying that an ounce of prevention is worth a pound of cure is true, and we should take it more seriously. I found out that large numbers of university professors and health workers who on average are far more educated than the U.S. population have very low rates of performing pap smears, mammograms, colonoscopies, And these things are very important to the maintenance of good health. So I encourage people that in spite of the circumstances of poverty that we live in, one of the things that will significantly improve our health is taking preventive things as well as being more aggressive about initiating and maintaining contact with the healthcare system. For example, having your blood pressure checked once or twice a year will significantly improve your ability to survive, and having things like colonoscopies and pap smears, and when you are going to your doctor, carrying your medicines, asking questions, asking them what tests are required for your age. Those kinds of things seem like very basic things, and they will make a lot of difference to our lives.
Wonderful, wonderful, wonderful. I mean, you mentioned some key terms here. I mean, we would like you to explain them as time goes on, as we move on, because some people may not even be aware of these health things that they need to do. What is a pap smear? I know many educated people know that, but not everybody is well educated. Yeah, you made a very big point, and I think it's very, very important because, as you said, common sense, prevention is better than cure. And especially in Africa, where we don't have the resources and the machines and all that, if we could go ahead and take good care of our health by doing the basic things like exercise or those basic things that they are saying maybe to help us. And I know very well that this is what the Obamacare is trying to do as well, because the intention is to cut down costs, because when we don't do these things that you are suggesting to us and that you'll be saying more of them, what happens is that they lead into higher costs, because when you wait too long before you do these things, then complications come in, and then that's where surgery and all those other things come in. I don't know if Mr. Abion-Mensah has something to add to this, because I know this is also your area.
Yes, that's my passion, is prevention, especially in areas where you don't have enough doctors and nurses. Many things that can be done. Encourage people to, prevent diseases, or don't sit around and wait till, you fall apart until you see a doctor, and that's not good at all. Especially like we have many people in the cities around here, some guys and ladies who drive taxis, and they go to work all day, then come home after 6 o'clock or something, and all they will do is to eat big bowl of rice or fufu or some heavy carbohydrate, and then go to bed, wake up, and they go again, and they will never take any time to go see a doctor for a checkup. Know their blood pressure, their cholesterol level, their sugar level, and all those things. So the doctor is really on track with what he said and his concern. Prevention is the key to the whole process.
Thank you. And as you know, when we talk about health, I mean, we cannot finish it in a day. Even a year is not enough. But so long as we have the time, the basic ones, I think it's good for us to spend time on that. And that is, we are trying to help our colleagues and our friends to be able to lead a better 2014, so that those diseases that causes these fatal problems will be solved. Dr. Kennedy, you talk about checking blood pressures, at least once a year. Why should we check our blood pressure? Somebody may ask. I'm a young man. I don't have any problems. Why should I check my blood pressure when I'm not sick?
Well, because blood pressure happens to have another name that most people don't know of. It is called the silent killer. Blood pressure actually is an artificial concept. They found out that they were trying to find out why certain people were having high incidence of heart attacks and strokes. And they found out that these people, as well as things like congestive heart failure, and they found out that these people had arteries that were harder than that of the other people, and these hardened arteries could be manifested in higher blood pressures. So the reason we call it silent killer is that most of the time somebody would have high blood pressure for years without having any complaints, and all of a sudden they would have a stroke, which of course we can elaborate on, or a heart attack. Or all of a sudden they will start showing signs of congestive heart failure. And all these diseases were very big killers. So we developed the concept that, even if despite the fact that the blood pressure might not be symptomatic, if it is high, and you could be given medications that lower the blood pressure, this could be correlated with lower incidence of heart attacks and strokes, and therefore with saving lives.
Well, that's very, very important. And one thing too, we know that it doesn't cost that much to check your blood pressure. Even you can go to any of these pharmacies and that check it, even for free. So, I mean, it's good. Yes, so we have to note it. It is very, very important. Sometimes things are very dear, but they come as free. That's like something like water. So we have to take it very serious. Check your blood pressure often. And also, Dr. Kennedy, you talk about, Mr. Abiomed, I'll come back to you because I know the blood pressure, you have other things that can also lower it, food and all that. We come to that. But let me ask Dr. Kennedy, you also talk about women. You say women must have a pap smear every 1 or 2 years to screen for reproductive cancers, and women over 50 should have mammograms yearly to screen for breast cancer. May I ask, somebody may ask, what is pap smear? Because you have people maybe in Ghana, in these African villages, and they haven't heard anything like about pap smear. Can you break it down for them?
Yes, let me try and see if I can do that. People have done a lot of research that shows that we don't just wake up one day and develop cancer. It's not like you go to sleep today and tomorrow you have cancer. That there is a transition between being normal and having cancer. And that for quite a number of cancers, this transition is very slow. 2 of these cancers where the transitions are slow, let me make it 3 so we are more balanced. One of them is reproductive cancer or cancer of the cervix, which is the end of the womb. The end of the womb is called the cervix, and it's one of the commonest sites of cancer in women. It turns out that the transition from normal cells to cancer cells in the cervix takes about 5 to 10 years. So a Greek doctor who settled in the United States called George Papanikolaou developed a system whereby if you scrape the inner lining of the cervix and look at it under the microscope, you could see cells in transition. In other words, these cells were not normal, but they were not yet cancer cells. And that if you remove these cells, you could save the woman from developing cancer of the cervix. In order to do this, he did a pap smear on his wife almost every day for 5 years. So I think women should celebrate Mrs. Papanikolaou and her sacrifice for all of them by having these pap smears. And it is recommended that a woman starts having pap smears whenever she became sexually active, and or whenever she turned 21, and that these pap smears should continue until she turns 65. If they have been normal, then she could stop.
Wow,
that is for the pap smear. As far as breast, should we go on, or let's go on, and whenever you like, I can explain this.
Go on. I want to know more about the mammogram, the correlation between mammogram and breast cancer.
Okay. And the mammogram crew, as a researcher did this, he photographed breast of women of cancers that have been removed from the breast. And he finally found out that it turned out that before normal breast tissue becomes cancerous, it develops a pattern of calcification, deposition of calcium that is distinctly different from normal breast tissue. This was the genesis of the mammogram. So the idea was that women, and it turns out that even women as young as 30 can have breast cancer and all that, but you always weigh cost and benefits. It is found that when women turn 40, according to American Cancer Society, if you did a mammogram every 1 to 2 years, you could pick up breast cancers. But when they turn 50, there is no dispute that everybody agrees that if you did a mammogram once a year until the woman turns 70, you pick up quite a bit of breast cancers. And when you pick them up early, you can remove the cancer, and you don't have to remove the breast, and it hasn't spread. So as far as cancers are concerned, The earlier you can detect them, the better, so that you can do something about them. So that is the idea. And one of the things that I found in Ghana, according to research, West African women develop cancers earlier than North American women. So it means that the North American recommendation to wait till 50 before you do mammograms every year might even be inappropriate for West Africa. We should be doing the mammograms sooner than 50 in West Africa.
Oh, that's great. That's great news here. Now, Mr. Abiames, I know you are very good on the preventive side. Of course, one of them is going to see your doctor, going to see these mammograms, and also doing the pap smears and all that. Are there any fruits or foods or something like that, or maybe that can also help apart from the medicinal aspect?
Okay, so, we eat to live, and many people don't realize that the body can talk to you after you have consumed certain foods. And one of the preventions is trying to eat the right food. And fruits and vegetables are very, very good if you are not allergic to a particular fruit or something. And any time you try that, you will realize, how good it is for you. The body's mechanism, the first and the key medicine for the body is natural, and in many places it's not even expensive. It's water. Drinking lots and lots of water, not waiting until you're thirsty before you drink water, is very, very good for the body. And also the stomach flora. Your whole system is that if you have a very bad stomach, you will have lots of issues, and the doctor will attest to that. And so the stomach flora, if you get it by taking or eating yogurt or taking probiotics, will really help stabilize the stomach, and you can fight off lots of allergies by getting your stomach flora in the right order. And also, you need to be able to try to stay away from certain foods, and we can get into that later on, because there are some things we use as spices to sweet up our food, and some of those things are not good for us at all, especially the artificial ones in the cubes we put in food may not be very good for us. For some people, they have strong allergies to that. Whenever you finish eating and you have a headache, your body is telling you that you ate something that is not good for you.
Wonderful. Yes, Dr. Kennedy, before we move on to the men and talk about colon cancer and all that, I would like you to make, if you have any comment to make with regards to the food and how it also contributes to, stabilizing our health.
Actually, Mr. Mans is right. He makes very good points. And actually, I spend quite a bit of time talking to my patients about diet. I tell them that, when you look at somebody, most of the time, their attitude to things like exercise and diet tells you how much they value their lives and their enthusiasm for life. And I encourage people, I tell them that, you cannot just press a switch and all of a sudden you are trim and you are fit and everything. It's one day at a time. And like he says, you go to exercise. I tell them that probiotics help. And I also tell them that I talk about what I call my street corner diet talk, and they are mainly about 4 or 5 bullet points. Cut down starch, cut down fat. And this means that if you used to eat 3 servings of rice, cut down to 2. If you used to eat a lot of fried things, go to grilled, And I tell them also that meat, pork, rams, whatever, let's cut down them. Then increase fruits, increase vegetables, increase fish. Those are very, very healthy things. Then 2 more things. If you can, eat a breakfast every morning, preferably cereal. And finally, don't eat late at night. Because if you eat late at night, and the women never forget this when I tell them, It is a moment of sweetness on your lips, which will be forever on your hips.
Yes, yes. And Doc, as you said about that, especially carbohydrates in the developing countries because of poverty and whatnot, people think if they eat a whole bowl or a tray of rice or cassava or whatever it is, fufu, kenke, and all that foods, too much carbohydrate, as the doctor said, it can be very, very deadly. And he said, carbohydrate will turn into glucose. And if you eat, the volume is very, very dangerous that we need to push, that people should cut down on the volume of the amount of carbohydrate that they eat. And then when it comes to sugar and salt, as the doctor said, sugar too can be very, very dangerous to the body if you imbibe in too much sugar.
Yeah, I will come back to that sugar because I know you have your miracle fruit, atadia, and other things, and people sugar. We'll come back to that, so keep that, and definitely we need to talk about that because when you get to diabetes, we need to know some of the things that we need to have so that we get a substitute for sugar, and then we will still not be contributing towards exacerbating that particular deadly disease. Yes, Dr. Kennedy, so far, as you said, I know you talk about 2 do's and also some don'ts. The first one is exercise regularly. I mean, that is a do. We need to do. When we talk of exercise, everybody knows exercise. But, maybe Mr. Mens can tell us a little bit, because sometimes people think they have to go to the gym in order to exercise. Are there some exercises that we can do without going to the gym? That's something that is regular, basic, that we may do fun and we may not even realize that we are exercising. For those of us who cannot go and buy a gym pass.
Okay, there are very basic things you do, like when you go to the mall, you will see that close to the door, it's very difficult to find a parking spot. This evening when I went to the store to buy some goods for tomorrow, I parked quite a ways, way off the door, so that you get your walking in from there. When I go to classes, I park about a mile away. I walk. I don't use stairs. I don't use the elevator. I use steps, and I take about 4 flights of stairs to get to my classroom. Then simple things like this will help. Squat, and even the way we sit. He said, don't sit all day. You need to stand up. I listen to Dr. Oz a lot, and he said, you need to try when you sit, every 15 minutes, you need to stand up and try to do just light exercises, try like squatting, some little things that your body can take. It's not, you see, the whole thing is a way of life, okay? It's not, if you are intentional, it's good, but you have to be intentionally do it as a way of life. And so people are going to make New Year resolutions and fall off the wagon in a week or 2. No, your whole lifestyle has to change, and it has to be a way of life. And once you have that going, nobody will tell you to go to the gym or what. It's so sad when you go to the gym to see some old people walking down, and that's a prescription from a doctor that you should walk a mile or something a day or 3 times a week or whatever, because they didn't do that when they were young. Yeah, some things you can't prevent due to genetics and whatnot, but basic things we can do will really help us to get the body in shape.
Great. And Dr. Kennedy, I think one of your views, you said eat a healthy, low-fat, low-salt diet. I'd like you to help me with what a low-salt diet is. But before then, I want to add the second question, that is the do's. You said eat healthy breakfast whenever possible, because some people may want to lose weight and they decide to skip breakfast. Is it a good advice?
Well, surprisingly, according to the researchers, breakfast is a very important meal, and sometimes I'm guilty of that. From medical school, develop a habit of getting up and going without eating. According to the experts, having a good breakfast is very good, and particularly if you can make it cereal. And surprisingly, eating very late is also not good at all. So if you can control the way you eat, two things will be have a good breakfast if you can, and make a cereal and don't eat late at night.
Okay, soft diet. What are some of them? Low salt diet. I think it's good, right?
It's good, but the main thing is most of the salt we add them artificially. So you just have to watch how much salt. For example, and it breaks my heart to say this Kobe. If you're a Ghanaian, you shouldn't be too fond of Kobe. And if you are using it, make sure that you balance the meal so that you take out other things that will add salt, so that in the end you are not eating too much salt, because it's not very good for your blood pressure.
And for those of you who don't know, Kobe is salted fish, highly salted, concentrated salted fish. Yeah, and also before we go, I read something like those who eat less meat live longer, and especially people who eat something like tofu and all those things. Mr. Abiyomi, can you just take 30 seconds and comment on that, and then we shall move on?
Okay, yes.
The meat so that they can live longer.
Okay, yes. Red meat, eating red meat, because of the doctor will tell us all kinds of chemicals in red meat or whatever it has, can really contribute to high cholesterol, even cancer and whatnot. If you see, everything is moderation. Moderation is the key. But if you can stay away from certain foods, or stay away, even the doctors will recommend go meatless at least once a day in a week, 1 day in a week. Do not eat meat at all 1 day in a week, and that will really be good. Chicken, turkey, fish, those are something that is highly recommended. But if you have, taste for me, some people is every day, and some say, I can't stop eating hamburgers every day or eating this every day. But moderation is the key, and that will help a lot to live longer.
Okay, and also I believe meat is protein, and there are also some natural, of course, meat is also natural, things like beans and maybe spinach and those things. Can they be a substitute? Of course, people are vegetarians. Dr. Kennedy, just a sentence.
Yes, and they can be substitutes, and actually a lot of parts of the world where people are poor and their consumption of protein is not up to par. And in those places, plant proteins are very affordable substitutes. For example, a lot of Ghanaians swear by yoke gari, which is actually a very balanced meal.
Okay, let's move on. Dr. Kennedy, one of your rules is do not smoke. It is perhaps the biggest killer on earth. We know this, but people still do. Can you help us so that people will actually understand why they shouldn't smoke? It's not like we are taking their civil rights or their whatever from them, but we are trying to help them to live longer. Why shouldn't we smoke?
And because it is a killer. It is associated with a lot of illnesses. If you live in North America for some time, where people live long, COPD, chronic obstructive pulmonary disease, most people who have it smoke. It is associated with elevated blood pressures. It is one of the biggest risk factors in heart disease as well as strokes. It's also associated with lung cancer and few other cancers to boot. So, on balance, smoking is just bad business, and actually it is one of the biggest predictors of early death. And that is why in North America, people have moved to banning smoking in a lot of public places. And actually, just yesterday on NPR, they were talking about the government of China. China is now the world's probably leading advanced smoking nation. And now they have also moved to starting to ban smoking in public places. So it is not good. Unfortunately, though, even though in Ghana, I realized that Ghanaians don't smoke that much. they actually make up for not smoking by drinking to excess, which is, of course, also deadly.
Okay,
yes. Yes, go on.
Okay.
Hello?
So we know smoking is not good. Smoking kills. It's as simple as that. It doesn't need any, cannot be simpler than that. It kills. So stop smoking. It's very difficult, but I mean, as a habit. Mr. Man, how can somebody stop smoking? Any advice?
The doctor will be the best.
Actually, there are ways in which you can actually stop smoking. One, if there are any physicians on the program, I will encourage you to keep reminding your patients of the need to quit smoking. If you have loved ones who smoke, keep reminding them of the fact that it's a threat to their lives. It works after you do it repeatedly. Psychologically, it is addictive, so it is like every addiction. You need to have the will to stop it. Once you decide that you want to stop it, there are things that can help. Things like the Nicorette gum, then you move to medications like Chantix, and then you move to some other stronger medications that your doctor can prescribe. So there are actually medications that work by making it be a little unpleasant when you want to smoke, and all of them assist you. But the first thing is for the patient to commit to the fact that they do not want to smoke anymore.
Okay. And then another factor in third world countries especially is environmental factor. The cars, the dust and all. I have a friend who has this bronchial issue because of the dust where he lives in many, many homes. You will see that things are very, very dusty. And they have a theory like when you have a fan on, you wake up in the morning with a sore throat. Unbeknownst to many people, is the fan blowing dust that gets into your lungs, and then you have reaction towards that. And so environmental factors are key also. And then second-hand smoking. People burn all over lorry tires, wood, and firewood, and all that smoke that gets into their system can also affect the health of individuals.
On that note, I think the environmentalists or the government should try to, especially in Africa, as for here in the West, you can't do these things, so it's not much of an issue because the car has to go for inspection and they have to inspect all that. But back in Africa, it's an issue, so the government should try and also help so that they come out with policies so that people cannot be burning stuff in the open. And also second-hand smoking, they should do something to prevent it. Dr. Kennedy, there's one also very, very important thing that you advise your audience as well as your patients when in your article, which is also very good, if you want to live a better and a healthier 2014. And one of them is also do not have unprotected sex with multiple partners. Can you explain that a little bit for us? But before you do that, please, I want to take you back. Both of you mentioned probiotic. Can you explain what a probiotic is? Because maybe some people are listening, they would like to use that because I think it's a good thing.
Okay, I'll let Mr. Menz take that.
Okay, probiotic, yes. What is it?
Okay, probiotic is a supplement. Sometimes when you are put on antibiotics, some doctors will even recommend that you take probiotics because, like, if it kills, you see, antibiotics will kill the bad germs that will be in your stomach or whatever in your blood system. And if you do that, sometimes it will kill the good ones also. And probiotic will help you to balance that. And once you have that, then your system will be able to ward off all kinds of diseases, especially allergies.
Okay, good. So now when, at least the audience, you go to the pharmacist or you can ask for probiotics after you've taken the antibiotics, so that things could be done. Yes, let's go back to the unprotected sex. how is it related to our better health in 2014?
Oh, okay. And actually, to add to what Mr. Mann said about the probiotics, actually, in a lot of grocery stores these days, Walmart and others, they actually sell things that contain probiotics. And the idea is to hopefully supply good bacteria to your body, because there are actually bacteria that live on our body, particularly in the GI tract and in the vagina, in the nose, and quite a few other places. And these probiotics make sure that the balance is kept in favor of the good bacteria, and this keeps you healthy. So to go to the
a good source of that. Greek yogurt. Yogurt is very good for probiotic.
Okay. Can I continue now?
Yes.
Okay. So the sex thing is actually pretty straightforward. Of course, a lot of children are born every year, and the reason all those children are born is because there is unprotected sex. But of course, when people have unprotected sex, it's not just sperms and eggs that get the opportunity to meet. There are a lot of bad stuff that get transmitted around, and these have generally been grouped into sexually transmitted diseases. The big one, the one that makes the headline, is HIV. But actually, there are a lot of others, like hepatitis. Hepatitis is a very deadly cancer. It leads to cancer of the liver. And in addition to that, hello?
Yes.
Hello. In addition to that, of course, we have old-time things like gonorrhea, we have syphilis. All these are transmitted. And then we have herpes, all of them do not kill, but they are generally not good. They lead to infertility, and syphilis in the old days, when it wasn't cured, could even lead to some mental conditions. So these are not very, very benign diseases. So they are not good things to get. So if you are going to have sex with multiple partners, certainly do use protection, because it's a very significant factor in life. And when I was in Africa, there was never a day when we were on world rounds that we didn't see people with HIV who were dying. Thanks to George Bush, a lot of them stayed alive longer, but it is still a very deadly disease.
Thank you very much. Talking about George Bush, I know that one of his policies, the ABC policy, was abstinence. Abstinence before contraception. And that is for those who are playing around. And also, he also preached about being faithful to your partner. That is also one of those solutions. So, in addition to using sex, you have to be faithful. Can we take maybe 30 seconds break, sip some water, and we come back, and then we talk about 7 fatal diseases that has been identified by Dr. Essel. Basically, those are some of the basic diseases that are killing people in Africa. And then we see how we can try to stop some of these things, and also we can talk about some fruits like asabia and the nuts and all those things. So we take 30 seconds of break and get some water. As Mr. Abion said, drink water. Drink it even when you don't feel like drinking.
Current events, combined with a knowledge of history and common sense. Good Evening America with Otri Bona continues in just a moment. More of Good Evening America with Otri Bona is coming up from the Harambe Radio Network. Current events, combined with a knowledge of history and common sense. Good Evening America with Otri Bona continues in just a moment.
All right. So welcome back to Good Evening America with Bona. We are continuing our discussion on a better health in 2014. You've been listening to Dr. Arthur Kennedy and Mr. Abion Mens. We continue with our discussion on how to keep a better health in 2014. Yes, Dr. Essel has identified 7 diseases in Africa. Of course, not only in Africa, it's all over the world, but some of them are peculiar to Africa. And he named them. The first one is heart disease, stroke, cancer, diabetes, malaria, diarrhea, and then he also named a 7th one, which is accidents, like the carnage on our roads. And accident can be any kind of accident, how to take care of ourselves. Yes, I would like us to, Dr. Kennedy will help us maybe quickly to talk about, let's take the first one, heart disease. I know you've mentioned a little bit about these, but maybe we can be a little specific so that we will move on to some of the things we can do to prevent, physically, but health-wise, can you tell us a little bit about these things, how they come about and how we can resolve them?
I don't know that we have enough time, but let me say, when we talk about heart disease, the heart has 3 layers. There's the outer membrane, there's the muscle, and there's the inner covering of the heart. Each of them can have diseases. The commonest one that comes to our attention is what we call coronary artery disease, which means that narrowing of the arteries that supply the heart itself with oxygen. You know that the heart is the pump of the body. If there is something wrong with the heart muscle, it's not going to be able to pump blood to the rest of the body. And so it leads to the death of heart muscle, and that is called myocardial infarction. And it's actually the biggest killer in industrialized countries. Heart disease is basically caused, or is commoner in people who smoke, have high blood pressure, have diabetes, or have it running in their families, or have elevated cholesterol. These are the biggest risk factors. So the treatment of heart disease, we have emergency systems and all that, but the key thing is prevention. Get people to quit smoking, lower blood pressure, lower cholesterol, treat diabetes, and basically exercise. Those are the things about heart disease. There are, of course, other heart conditions, congestive heart failure, which comes when people have high blood pressure for a long time. There's cardiomyopathy. There is endocardial valve diseases, like the valves of the heart getting diseased. And then there is also pericarditis, but the big one, obviously, is myocardial infarction.
Okay, good. Yeah, Mr. Avion Mens, I want to zero into diabetes, the sugar disease. As I said, we don't have much time to talk about all those other 7 things, but at least we know one of the prevalent diseases all over, even here in the States, as well as Africa, is diabetes. It's killing a lot of people these days, people because of dieting and other things. And you talk about the miracle fruit, you said asaba, the berry that makes everything sweet. Can you tell us a little bit about this and how, because according to your writings, it helps in weight loss, that is weight control. It also manages diabetes, and it also has a role in chemotherapy and all that. Can you quickly help us to fall in love with this fruit, asada, so that we can look for it?
Okay. Okay, as we are winding down, the key to summarize it is just for us is intentionality, to really be intentional, take control of one's health. But diabetes is becoming an epidemic, and it can be prevented, and it can also be maintained. It's not a death sentence. Some people make it to be a death sentence, but it can be maintained and it can also be prevented. And one of the maintenance or prevention is limiting the amount of sugar intake, high volume of carbohydrate. And in Africa, we are surrounded by so many fruits and vegetables that are very, very healthy. Even coconut right now is in vogue. Everywhere you go, you see coconut. Cocoa is also very, very good. But we have a fruit called miracle fruit. In the local dialect, it's called asaba infante. In Twi, it's asa. And in Ga, it's tami. And that, it will surprise you that the company, you can go online right now and Google miracle fruit. They sell it as M-Berry. You can buy M-Berry even here in the United States. And miracle fruit, Asaba, is such a wonderful fruit. It's like cherry. And if you just suck on one for the next hour or 2 or 3, everything you will eat will taste sweet. And so you can drink tea, you can eat anything, cereal, whatever, without sugar. And some people do not even like to drink tea without sugar. But if you have a saba and suck on it and just start eating, everything will taste sweet. And it's not a sugar substitute, but it's nature's way of letting you think that you have, or what you are eating is sweet. It's very, very wonderful. That's why it's called miracle fruit, Asaba, Asa, or Tami. And it's being sold in the market as M-Berry tablets.
That's a good information. I hope those of you out there, you hear it, get Asaba and stop taking too much sugar. I think it's better than all the other sugar substitutes. Yeah, Dr. Kennedy, there's one basic thing I want you as a health professional and a doctor to help us with this. So one of the other ways we can simply also cut off diseases and also prevent, have a preventive health is hand washing. Like good health, good hand washing is a good health. Can you help us? Because it's a basic thing that anybody can do. You don't have to pay a penny.
Absolutely. And it is actually, if you think about it, it makes sense because one of the things that makes humans very different from a lot of other animals is the fact that we are social. And a lot of our social interactions involve the hands. We shake hands with people. And that kind of handshaking and others is a very common way of transmitting diseases, both to ourselves and to other people. So you realize that when, for example, you go to a funeral in Africa, you shake a lot of hands. Whenever you meet people, you are shaking hands. So whenever you kind of have an interaction with somebody and you wash your hands, you are in effect cleansing your hand of germs. It is recommended, for example, that every doctor either wash their hands or clean the hands with alcohol after seeing one patient before going to see the next, so that you don't transmit infections from one person to the next. It is also recommended that after you use the toilet, you wash your hands, so that you don't carry any germs. Particularly, you go to a place where it is very busy and you are opening doors. Each time you touch the doorknob that a lot of people have touched, you are collecting some diseases. So hand washing is a very, very effective way of cutting down on the transmission of diseases.
And the key also, it has to be running water with soap, because many times in some cultures they have a bowl, common bowl, where everybody will wash their hand in that bowl, and that's not healthy at all. But if you can have running water with soap, that will be very, very good. But it's basic and it's very, very critical, especially in cultures where people eat with their hands. It's not safe at all. Mechanics will just get out from under a car, put their hand in a bowl of food, and not wash their hands, and that can be very, very deadly. That's why we have so many stomach issues.
Okay, thank you very much. So we have to use running water to wash your hands. Yes, still talking about these fatal diseases, heart disease. Dr. Kennedy has talked a lot about that. Unfortunately, we couldn't talk about stroke. He has talked about cancer. We have also talked about diabetes. Unfortunately, we couldn't talk much about malaria, but maybe in the closing statement, Dr. Kennedy can say something about these things and diarrhea disease, and then accidents. But here, Dr. Essel has also provided 10 ways to prevent these things. And the following points will help you fight or prevent the fatal 7. And the 7 is what I've mentioned. 1, commit yourself to be healthy for life. And then 2, be at peace with God and man. This relieves undue stress. And then number 3, exercise regularly and appropriately. And number 4, eat right. And this includes a lot of fruits, vegetables, and whole grains. And number 5, drink adequate amounts of water. Don't wait for to feel thirsty, as the comments right there. And then number 6, get rest. Number 7, stop smoking, as Dr. Kennedy has rightly said. Minimize alcohol. Ensure personal and environmental hygiene. Number 9, get regular medical checkups or screening, just like Dr. Kennedy has said. Number 10, if on medication, take as prescribed. If in doubt, seek a second opinion. Do not take overdose. Okay. And then on the accidents, which is the 7th one, which is prevalent in Africa, this is what he says. The accidents at home and in workplaces also occur, and we need to be mindful of these and put in the right structures. This applies to both the government, families, and everybody. We have to put in the right structures so that we can prevent these accidents. And also, sir, do not drive when you are drunk. Do not drive and drink. Drink and drive. And then avoid the cell phone when you are driving. And then learn the appropriate way to react when there is fire. Wear protective clothing at work where required. And then use anti-slip masks in baths and wash electrical appliances. And number 8, always remember the kitchen is no extension of a child's play area. The list goes on and on. So I will move on to Dr. Kennedy, and then we will be giving closing statement. And I'll be very happy if in your closing statement, I think we have 4 minutes, so you can take 2, maybe you can take 2 or 2.5 minutes, and give the rest to Mr. Menz. If you can inculcate the stroke. We didn't talk about stroke. Stroke is killing a lot of people these days.
Well, I think we can't talk about everything. So stroke is the equivalent of heart attack on the brain. Stroke is brain attack. And it's also very common. It also has the same risk factors as heart disease. Another thing that we didn't mention that is actually becoming very common in Africa is drug abuse. The use of illegal substances, cocaine, heroin, those things, they are going to become bigger and bigger issues. I think on the list of disease, I didn't see tuberculosis. It is a deadly killer in Africa too, that we should take heed of. But I think this was a very good program, and we didn't have the time to talk about everything, but everything must be started, and I commend Ochil for bringing up a topic like this.
Thank you so much. Yes, Mr. Abiamen.
Mr. Bona, thank you very much for this opportunity. We thank Harambee Station for opening this forum for us to be able to reach as many people as possible. The key is life expectancy, that we live as we eat to live. We don't live to eat. And also be mindful intentionality. Be intentional. And you see that once you take control of your health issues, you will see that you can prevent many, many things and not spend lots of money going to see the doctor or lots of money on medication and whatnot. Drinking water is very, very important. Hand washing is very, very important. Watching sugar, salt, and fat intake are very important areas we have to be mindful of. And then fruits and vegetables, they abound and they are very, very good for the body. Thank you very much and Happy New Year.
Okay, thank you so much for coming to the show. And also to add, for a better 2014, we need to be closer to our God. We need to have a good relationship with God, because everything starts with your Creator. Because when we are disciplined, it comes from, having a good relationship with God. And then you understand why a lot of things God is telling us not to do, like smoking, drinking in excess and all those things. Everything in moderation. So as we go into 2014, let us do the basic things, the little things like washing our hands, and the big things will follow. So those of you who are bent on big resolutions, and usually the resolutions don't help, just go with the basic little one. Dr. Kennedy, I think you have something to say. I have a minute for you.
I just think that people should go to the website. My article on healthy health was actually reproduced by Daily Graphics. It's on their website. If you look at my Facebook, you might see that the Daily Graphics did a very good job of summarizing it. So read it, add to it, and I wish everybody the best of luck in 2014. May we all be healthy and happy.
Okay, great. And I think Mr. Mayor still has a website. Can you just quickly give us your website?
Okay, my website is just What's in Your Hand, WIYA. And once you do this, find it. Just have it on the internet, so I don't even have the.
Okay. All right. We'll bring it up. And I wish I had it here, but I think when you put in what is in your hands? When you put it in, maybe you see Mr. Abion's address and see the website. Also, those of you out there, book out there which just came out, Africa and the Homosexual Agenda. You can get it from Amazon.com or from Barnes and Nobles. And you can also visit me at Amazon. My name is Okyere, OKYERE. You see some of my latest books. You may be interested in them. On that note, I say have a very wonderful, healthy 2014, and I hope to see you back next week. And thank you, Harambe, and have a very pleasant and wonderful new year. Thank you.